Welcome to this session, Behavioral Science Tools to Promote Uptake of Prevention Measure. My name is Camille Léger. I'm a PhD candidate in psychology at the University of Quebec in Montreal. I'm also working with Kim and Simon, and I'll be chairing this 90-minute session. With no further ado, let me briefly introduce our first speaker, Dr. Robert West, who is a Professor Emeritus of Health Psychology at University College London. He specializes in development and evaluation of behavior change intervention. He currently advises the Public Health Wealth Behavioral Science Unit, and he is co-founder of the COMBI model, the Behavior Change Wheel Framework, and the Prime Theory of Motivation. He has authored or co-authored more than 900 scientific papers and 18 books, including The Behavior Change Wheel, Energize the Secret of Motivation, and React, Harness the Animal Brain. So over to you, Dr. West.
So what I want to do in this 15 minutes or so is to take you through a tool that I've been developing with colleagues initially at Public Health Wales with the behavioural science team there. Ashley Gould been very much involved in this for those of you who know him. And then more recently, getting input from WHO and Elena Altieri and her team. And in fact, some tremendously good, useful input from someone called Esther Flanagan, who you may not know, she works at the College of Policing in the UK. But essentially, this is a tool that aims to bridge the gap between the science and the practice and give people a framework to apply the evidence and in fact, maybe as well to gather evidence so that we can develop more effective interventions. So it's just one tool. It's very much work in progress. I'll just go through with you sort of live in a few minutes, but I'll just want to just introduce it first of all. Okay, so the tool is known as the Cactus tool. And what I'm going to do in these few minutes is just to give you some background to it, a brief overview of the COMBI model, which you probably are all familiar with, but I want to give you a particular perspective on it, how it's used to help design behavior change intervention, and then where this tool, the Cactus tool, fits into the process. I'm sure many of you are familiar with this, so I won't go into it, but in case you're not, the link to the website, which has details of this framework is here below. The Behavior Change Wheel Framework, which has been around now for almost 25, it can't be true, no, 15 years. The idea behind the framework is really to pull together the various different theories and ideas and models that people have come up with over the years into a single usable, applicable framework that in principle could be applied in any behavioral domain. And the idea is you start with an analysis of what needs to change in terms of the COMBI model. You then work out to what broad intervention functions you want to try and target as a result of that, and then you develop your implementation options, and which will be some combination of communications, legislation, and so on. So with the COMBI model, just as a refresher, this is about the most concise version of it that I can come up with. It is at one level, it's a very simple and common sense model, but obviously, as many of you know who've gone on to apply it, there are quite a lot of nuances, and I think there's a lot of decisions to be made when you're applying it that depend on your insights in relation to behavior and also the evidence. But the basic idea is that for any behavior to occur on a given occasion, a person has to have the physical and psychological capability to do it. They must have the knowledge, understanding, they must know what to do, know how to do it. They must physically be able to do it, and so on. Obviously, they need to have the physical and social opportunity to do it. Physical opportunity, they must have the time, the resources, the materials, the money, and so on. Social opportunity involves things like the social support that may need to be in place, but also very, very importantly, the social norms that exist out there and the restrictions and regulations that occur in our social environment. And then the third component of it, which is a little bit more nuanced, they have to be more motivated to do that thing than anything else that they might be doing, any competing behavior in that setting at that time. And that's a very important caveat, because our motivation is not always stable. It varies from moment to moment. And at that moment, it's crucial when you're trying to figure out how to motivate someone to do something, if that's the task, to have an understanding of the circumstances that they are in at the challenging moment, and figure out how, whenever you deliver your intervention, which might be many hours, days, months earlier, how to make that intervention count at that moment. And remembering that it's always a competition between different behaviors. And then obviously capability and motivation mutually influence each other. Our understanding is influenced by our desires, for example. Our beliefs are very much influenced by what we want to believe, and the other way around as well. Capability, our understanding of the consequences of behaviors, obviously influences our motivation and so on. Opportunity also influences motivation, and behavior feeds back onto all three of those things. So it's a dynamic system that is always in flux and changes over time. Now, that's the kind of individual level model, the moment-to-moment model, the sort of atom of behavior and behavior change. But a lot of the time, particularly when we're dealing with, for example, population health and behaviors related to protection against COVID, for example, then it's a different story. We're not dealing with individuals at particular moments in time. So you have to figure out how you translate that moment-to-moment model into the kind of population version. And the way that we do that is to recognize that populations will vary. You'll have variation across individuals, but you'll also have variation over time. What may be true at one time won't necessarily be true at another time. In my own main area of smoking, for example, we might be interested in what is the rate of quit attempts in a 6 months period. So that's our kind of unit of analysis. And in order to do that, therefore, we're aggregating across those atoms, those components, and we're looking at means and percentages and modes or other kinds of statistics. And those then become variables in our model. And you can use lots of different kinds of models. I'm involved in creating agent-based models, for example, to track population parameters over time. There are lots of different kinds of models, but essentially what you're looking at there are variables that apply at a population level over a period of time. And then the causal relationships between the COM-B components, which at the individual level are very much about processes and the physical universe, as it were. When we're looking at it at this level, we're looking at often causal associations between variables, which may be considered as additive or interactive or whatever. So this is how you go from the atomic version of the COM-B model to the population level version. And to help with the notation there, I've just put a sort of underline. This is the first time this notation has been presented to the public, since I only made it up a couple of days ago. So the idea is that, to help people to realize the distinction between those two. Right. Okay. So how do we use it to help design interventions? Well, many of you will be familiar with the basic scheme, which is that the first thing you have to do is to decide on what behavioral outcomes you're looking for, and in what population and in what setting. That's kind of step one, and that's a whole process associated with that, which may involve systems mapping, for example. Then you want to identify or generate relevant evidence to decide what COM-B influences that you want to target. For example, a very simple example is if you're trying to or get more people in a given population to wear FFP3 masks in situations of high risk, then it may be that they don't understand the benefits, in which case, it's perfectly reasonable to focus on that aspect of capability. Or it may be that they understand them perfectly well, and it's completely pointless going on about it because that boat has already sailed, or that job is already done. And actually, the key thing is that no one around them is doing it, or they believe that no one around them is doing it, and it wouldn't be normative for them. So maybe that would be the target. So you've got to do the work, the behavioral science work, to figure out what are appropriate targets, and then you use that to determine what intervention functions to choose, and ultimately what behavior change techniques. And that's essentially where this tool comes in. And again, just as a reminder of the intervention functions in the behavior change wheel, there are 9 of these. They're very broad functions. And it's worth just remembering that any given intervention or intervention component will very often target more than one of these. For example, when you talk to someone or you produce some mass media communication aimed at letting people know about the benefits of mask wearing or of social distancing or whatever, you're usually not just going to do that in a way that is neutral and just informative. You want to also try and make it attractive. So education and persuasion often go together. And very often, I think we jump too early into thinking, well, it's going to be communication and it's going to be education. And one of the things that we want to try to do with the behavior change wheel is to encourage practitioners and policymakers to look more broadly at what the options are that are available and whether there are other ones that they might consider. And then that takes us to the specific behavior change techniques. And some of you will know, I think, that in the team led by Susan Mickey, who I work with, we've moved from the behavior change technique taxonomy, BCT-TV1, to the behavior change technique ontology, and the link to that is down at the bottom there. And that's a much more structured way of looking at the behavior change techniques, so that you can look in a more granular way, but also find relevant techniques more easily. And on the slide here, what I've done is just to show you the top level of those, the kinds of behavior change techniques that exist in that ontology. And you can see that they include things like shaping goals, raising awareness of behaviors, managing mental processes. Pretty much, ideally, that's the plan, is that this covers everything that you might want to do. And so the trick then, and the reason for the tool, is how do you go from your target behavior and so on with your combi diagnosis through to your choice of behavior change techniques. It's only part of the process of developing an intervention, but it's an absolutely crucial part. And so the CACTUS tool, CACTUS stands for Combi Assessment Criteria to Intervention Strategy Spreadsheet, because it's based on a spreadsheet at the moment anyway. The idea is that in the tool that you specify your behavioral outcome, your population and setting. If you don't do that, you're nowhere. You haven't even got a starting point. So just being reminded to do that is not necessarily a bad idea. And then you use available evidence, or you generate the evidence to answer a set of questions, which I'm going to show you. And then you use that to prioritize your combi targets. And then you go on to use a mapping process, which the tool provides, to identify relevant intervention functions. And the tool is there as a Google spreadsheet at the moment. A word of warning for you is that it really is for power users. It's not to say that you can't, it's not, not everyone can, would get something from it, but you need to know something about the combi model and behavior change techniques to be able to use it. And there's a QR code there to save you having to type in that spreadsheet. And these slides will obviously become available after the talk. So before we go on to just a very, very quick demo, these are the 24 questions currently in the tool. This is going to change a bit, and the questions can be changed and shaped by the users for their own particular domain and to suit their own purposes. But the aim is to cover the ground in terms of the kind of combi targets that you are likely to want to work from. And with capability, we've got ones like how aware are they of the behavior and precisely what it involves, what constitutes it, how well do they know how to do it, how well do they understand the benefits of doing it or the costs of not doing it, what's their level of confidence that they can do it, so on and so forth. With opportunity, it covers things like, can they afford it financially? Do they have the resources, the equipment and so on to do it? Are there already formal rules or expectations about it? And obviously it covers things like norms as well. And then when it comes to motivation, we make a distinction in the combi model between what people think as a good idea, the sort of reflective motivation, and the more emotional drive and habit-related motivation. So on the on the reflective motivation side, we've got how worthwhile they think it is. But then there's the more sort of emotional side. How much enjoyment or satisfaction do they expect to get from it? How well does it fit with their self-identity, and so on and so forth? So that's the that's a sort of brief introduction to it. What I'm now going to do is just to stop sharing my screen here and share instead the tool itself, just to take you very quickly through it. Hopefully you can see this. The tool consists of a Google spreadsheet, and at the bottom here you'll see the first tab is instructions, then there's the main spreadsheet, and then there's a whole bunch of other tabs there which you can sort of peruse, one of which is, for example, a master list of all the 280 something behavior change techniques and some stuff about them that you might find helpful. But so you'd start with the instructions. I won't go through them, but this is the spreadsheet itself. And what you do is you enter here, behavioral target, your population, your setting. Then in the next step, you'll see these questions, the combi questions, and you can select from here things like, well, it's not relevant, or there's little room for improvement, or there's some room, or whatever, or major room for improvement. And you do that, and then you can go on to the next step in which you say, okay, well, maybe let's take this one, major room for improvement. Maybe there's major room for improvement, but seriously, this isn't something we can do very much about, so it's not feasible, let's say. Or let's say we think it's very feasible. That then leads you to decide for this one, is it going to be a priority for us? So let's say we're going to have this as a high priority. So for each of these combi targets, you go through a process, ideally using evidence or generating evidence to arrive at a prioritization. That's the job. And then the next bit is what I've done for you, or what we've done, is to give you an idea about what behavior change techniques and intervention functions are going to be most relevant for this one. So if you look at this one, we've got advised paradoxical behaviors, generalized behavior, increased salience of behavior, et cetera, et cetera. So that's a very quick sort of cook's tour of it. As I say, it's quite daunting. I expect to see it for the first time, but you can mess around with it, and you'll have to copy it onto your own computers, either as an Excel sheet or or just copy it into your own Google Drive space if you use Google. Once you've done that, you can do what you like with it. You can maybe improve it, turn it into something much better. What we're working on at the moment is creating a better front end, better questions, and so on. And it will be work in progress in an ongoing way. But have fun with it, and we're very, very keen to get feedback as we develop it going forward.